Aseptic processing is a high-risk operation in the pharmaceutical industry which must be tightly controlled. Personnel proficiency is critical to the success to any aseptic operation, particularly if there is human intervention. Here to speak on the issue is Brent Watkins with Veltek, a contamination control company. Brent has been a longtime volunteer with PDA's Training and Research Institute. Brent, could you please tell us a little bit about yourself?
Sure. I'm a longtime industry veteran, as my son likes to say. I started in the industry in the late 1900s, which is accurate. I started in big pharma, so large scale, small volume parenteral operation. I wore a number of hats, including contamination control and aseptic processing on the filling line. I became a member of PDA in the early 2000s, joined the faculty I think in maybe 2008 or so, and have been on faculty ever since, teaching a variety of modules and a variety of courses.
That's fantastic. So you started with us after TRI moved to the Bethesda location.
Correct.
Which is great. Yeah, great. I remember all of that. So aseptic processing is really important, a really important discipline. Can you discuss the consequences of contamination in an aseptic processing environment?
So one of the things that we like to stress, Walt, to the attendees of our training courses and to all of our members, is that aseptic processing is ultimately about patient safety. And so we try to tie everything back to the individual unit or bag or syringe or whatever the final container is, and that there's a face on every container. So we can't operate in a no risk situation. There will always be a risk of contamination, especially when humans are involved. We're the greatest source of contamination, but our goal at PDA and our goal as an industry is to minimize that contamination for our patients.
I can really see how important it is then that it's done properly. We do know that, and based on your extensive expertise, you are an instructor at TRI, as I had mentioned, but for many of our aseptic processing related courses, and TRI does a lot of it. That's one of our primary focuses. I think it would be really interesting if you could talk about those courses and how they relate, how they provide a benchmark to the people who attend of the industry best practices to control contamination in an aseptic processing environment, because that's really what people are coming in here for. They want to know what are the best practices.
Gotcha. So our signature course at PDA TRI is the 100 course, the Mastery of Aseptic Processing. It's a 2-week course where individuals come in, and when I say individuals, I mean a variety of level of employee at a pharmaceutical company. So all the way down to operators up to senior directors attend this course. And it is a wide variety of everything from basic microbiology to cleaning, disinfection to sterilization. There's a list, again, of 2 weeks worth of modules, including a media fill or an aseptic processing simulation and the investigation that results from that media fill. Again, that's kind of our signature course, and we go in 2 different directions from that signature course. We have something that's a little more distilled, so like an 800 level training course, which is the fundamentals of aseptic processing. So instead of a 2-week course, it's a 3-day course, again distilled down. But then the other direction are more specific training courses. So many of the modules that are in that 100 level, mastery level course, or the fundamentals course have a 2 or a 3-day section. So things like cleaning, disinfection, things like environmental monitoring, filtration, sterilization, smoke studies, all have a 2 or a 3-day deep dive. So that's on site at TRI proper here in Bethesda. We can also take a vast majority of this on the road and go to our clients where they are, instead of them bringing 10 or 20 or 50 people to us.
That's really interesting. You know, when I do these videos with our experts, we have a lot of experts at PDA, as you know, and I learn stuff. I always learn something new, and it leads to an unscripted question often, Brent.
Sure.
But you can handle it.
Of course.
So it sounds to me like I have a wide variety of personnel involved with my operation, my aseptic operation, whether it be from filling or quality. And it sounds like PDA offers courses you can really come in for 2 weeks and be hands-on. Really,
Correct.
2 weeks, learn how to do a fill, learn how to do a media fill,
Correct.
do an investigate. But it sounds like you have courses. I didn't know this. So the higher level course can really condense the information.
Correct.
And
So there are a couple different models that companies embrace. Sometimes they send individuals and we end up training the trainer. So we end up delivering our information, our benchmarks, our anecdotes, our case studies to them, and then their trainer takes it back to the mothership, so to speak.
Right.
And then sometimes the experts go to California, to Colorado, to Boston, to wherever. And that tends to be more operator, in the trenches specific. So instead of sending 20 or 30 frontline operators, frontline cell and gene therapy or ATMP technicians to Bethesda, we will go to them and train them in-house in their building and comment and give anecdotes and feedback on their process. So they're kind of two different models here.
So it's really, we are set up in a way to help companies meet many of their needs then. If
Correct.
they need to send just a small group of people, they can just send them right here to Bethesda. If they want to broaden it out, you'll go on site.
We have a road show, yes, sir.
That's really, I do. I learn a lot. I work in the publications here at PDA, but I don't hands-on do this stuff every day. So this is really interesting stuff. And I know just from our micro meeting, the contamination control is so critical in our industry, and it's very important for the patients. You're very passionate about that. So as we wrap up our discussion here, is there any last thing you want to say to our readers? The people watching this video are not reading, but there are readers from the PDA letter. What do you have to say to them?
So a lot of times, whether it be on-site or in my little section here at TRI, I'm asked for some sort of a closing statement. And you can't see it, but off camera, I've got two big words written on my notepad, and it's patient safety. And from a senior level director to a site operations head to regulatory quality assurance, or a setup operator who comes in early to set up a filling line, one of the things that we stress is don't forget who our ultimate customer is. It's the patient in the hospital or the clinic or the infusion center. And every vial and every bag and every syringe that comes by goes into someone. It may go into someone that you know. It may go into someone that you care about. And so our guidance, what we're striving to instill in people is to be proud and be confident of the work that you do. You shouldn't shy away from getting your company's medication when you find yourself in the hospital. You should search out your company's medication and demand it because it is of the highest quality. And if you keep patient safety at the forefront of everything you do in aseptic processing, that's the key to success.
That's a really great way to put it, Brent, and I really thank you for coming here to PDA's studio, our new studio here at headquarters. You're here for the PDA Pharmaceutical Microbiology Conference 2024.
Yes,
so
sir.
I appreciate you taking some time this morning to come up and enlighten our readers and just talk on the issue about aseptic processing and training.
Thanks for giving me the time.
All right, thank you.
Yes, sir.